Positioning and pressure relief is one of the most overlooked but critical parts to stroke recovery. Without getting this right, you're risking complications that can be dangerous and lead to setbacks in your recovery. But here's the good news. By learning a few simple techniques, you can protect yourself and speed up your recovery. Stick around and I'll show you how. Welcome to Indie Neurotherapy. My name is Evan. I am an occupational therapist and I help stroke survivors and caregivers get the tools they need for a smoother recovery. Today, we're going to go through proper bed and wheelchair positioning, and we're also going to talk about proper pressure relief to help prevent these complications. And for survivors with limited mobility, proper positioning is not just about comfort, but it's also about protection. Because poor positioning can put stroke survivors at risk for complications like bed sores, increased spasticity, and blood clots. These complications make it difficult to move your affected limbs, so as movement starts to return, this can lead to poor outcomes. But even having good positioning is not enough. Sustained pressure in one spot for too long can push blood out of that area, eventually leading to a bed sore, which is why pressure relief is so important. So let's get started with bed positioning. Position the affected hand and arm using pillows to support the elbow and shoulder and bringing the arm away from the body so the hand is lying at the side of the body. If possible, have the palm facing up and the wrist straight. This helps reduce spasticity and prevents the arm from going onto the chest. Next, use pillows or wedges under the affected knee and hip to support the leg and prevent external rotation of the hip. Finally, position the ankle in a neutral position with the toes pointing up and back so the ankle is at a 90-degree angle. To help keep this position, you can use a bed boot or lightly wrap with an ace bandage to keep the ankle in a neutral position and prevent calf tightening. You can also help them lie on their stronger side for comfort. Start by gently crossing their weak leg over the strong one. Then have them hold their weaker arm with their strong hand while you help roll them onto their side. Once they're in position, tuck a large wedge or some firm pillows under their hip so it stays slightly bent, just like this. Make sure their arm is also supported with pillows to keep the shoulder safe and comfortable. Switching between this position and laying on their back can help relieve pressure and protect them from bed sores. And now let's talk about positioning when sitting in a wheelchair. For the affected arm, use an arm trough, lap tray, or a small pillow to keep the arm supported and prevent the shoulder from hanging. This reduces the risk for subluxations and pain. For the affected leg, ensure the foot is fully supported on the footrest and the knee is at a 90-degree angle. If needed, add a small pillow under the thigh to prevent sliding forward. Proper positioning is good, but it doesn't help prevent all these complications, which is why pressure relief is so important. Pressure relief takes the weight off of bony areas like the heels, the tailbone, which are common places for bed sores. Now, let me show you how to do pressure relief when sitting in bed or a wheelchair. When lying in bed, reposition every 2 hours to avoid prolonged pressure on any one area. Use pillows or wedges to offload pressure from the heels and tailbone to position to a slight side-lying position before positioning back after an hour or two. When sitting, pressure relief is just as important. Here's how to do it. Shift your weight every 30 to 60 minutes. Use your unaffected side to lean to the left or right or slightly forward to offload pressure from the tailbone and hold for about 30 seconds. You can also use a wheelchair cushion designed for pressure relief. All you gotta do is talk with your doctor and ask them to write an order for a wheelchair cushion. Doing all these techniques can dramatically reduce your risk of pressure wounds, but the fact is pressure wounds can still happen. So it's important to check regularly for signs of pressure sores. This can include redness or discoloration that doesn't fade, tenderness or warm areas on the skin, open wounds or blisters in high pressure areas. If you notice any of the symptoms, act fast by relieving pressure, keeping the skin dry, and contacting your healthcare provider immediately. If you found this video helpful, then be sure to check out the next video in my stroke recovery basics series on stretching and passive range of motion. In that video, I'm going to show you the right way on how to move a hemiplegic limb. So be sure to check that out, and I'll see you in the next video.